Hello, my name is Dr. Umesh Srikantha. I am working as a consultant neurosurgeon and head of spine services at Aster Hospitals, Bangalore. In this short video, I am going to talk about low back pain. Low back pain, as we know, is one of the more commonest causes that we experience in our lifetime. In fact, it is the fifth most commonest cause for physician visits, the third more commonest cause for any surgical procedure, the second most commonest cause for absences from work, and in more than 65-year-old people, it is the number one cause for any kind of a surgical procedure. So why is it so common? What predisposes so much to developing back pain? Basically, to understand that, we have to know that the spinal function is a balance. It's a balance between what the spine can withstand, or inherently how strong the spine is, which doesn't depend only on the bone or the disc or the joint, but the surrounding muscles and the ligaments as well. And also about what is the extent of stress and strain that it is subjected to, which probably is day-to-day wear and tear, which also is related to age-related degeneration, and also due to the several stresses and strains that we have to undergo on an occasional basis, when we try to lift an object that we are not supposed to lift. So these are the type of things that can precipitate low back pain in several cases. So any imbalance between these two, that is what the spine is able to withstand or how strong it is, and what it is subjected to, that is the wear and tear or stress and strain or even age. So any imbalance, this can cause result in a back pain. So where does this pain come from? So what is the reason why we develop back pain? So as we know, spine is made up of several structures. So it is made up of individual bones called the vertebrae. These bones are articulated together by joints, what we call as facet joints, and also the cushion that is there in the front, which is called the intervertebral disc. These in turn is supported by the muscles and the ligaments. So pain arising from the lumbar region can come from any of these structures. So it can come from the disc, the bone, or the joints, which are usually more serious and which requires a specialist intervention or opinion at least. But majority of the lumbar back pain usually come from the muscles and the ligaments, what we call as a stress or a strain or a sprain or a strain. So these are the more common causes of back pain. This can happen in any age group, especially after 20 years of age. And the good thing is that they recover almost spontaneously. In more than 90% of the cases, they don't require any kind of special attention or special intervention. And most of the times, home-based treatments like over-the-counter pain medications, like hot packs or a cold pack, light exercises, a physiotherapist's advice like an interferential therapy or an ultrasound therapy or a massage to the back, or even a period of relative rest, like a short period of rest for 1 or 2 days, is sufficient for these pains to go away significantly and for you to return back to work. But of course, this doesn't work. The home-based medicines doesn't work in all cases. There is a small percentage of cases where the pain can become persistent, where it can persist beyond 2 or 3 days time. So these are the situations where we have to understand, we have to recognize these situations, and we have to consult as appropriate specialist at the right time. So what are these conditions? So basically, you have to see a specialist in case if you have a sudden severe pain which is not showing a subsiding trend even after 3 days, that is, it continues to be more or become more, or it continues to remain the same even after 3 days time. If the moderate pain, even a moderate pain, persists for more than 1 week, any pain that lasts for more than 6 weeks, whether it is on and off pain, whether it is troubling you even intermittently, any pain that is more than 6 weeks, you should always see a specialist. Of course, pain that is happens after a trauma that persists even on lying down, or in some special situations where you are, if more than 60 years of age, or you already have some underlying predisposing factors like immunosuppression, cancer, you are prone to develop these spinal problems. So you should seek a consultation at a much earlier date. More important than these chronic conditions, it is important for us to recognize what we call as red flags. So these red flags basically are 4 in number. So one is if you have a severe shooting pain down your legs, what we call as a sciatica, which is persisting, which is severe. So this indicates a nerve involvement or a nerve impingement. There again evaluation is required about how severe the underlying cause is. If you start developing cramps in the legs, that is, if you walk for a certain distance and you start developing cramps in the legs, so that is again an indication that the space for the nerves is getting reduced, a condition that is more common in the elderly population, and again this requires evaluation and appropriate treatment. The third possible is more ominous cause like a numbness or a weakness that can develop in the legs. So again, these are conditions where the nerve is getting damaged or the function itself is coming down or getting impaired, and you should require an appropriate consultation at a particular time in these cases. Very severe cause is an urinary disturbance, or if you have difficulty in passing urine, if you are unable to pass urine, or if you have to strain significantly while passing urine, unable to control your urine. So in these cases, again, these are more ominous situations where suggests a serious underlying problem which requires urgent evaluation and treatment most of the times. So this video was basically to help you understand that back pain is not a very serious problem. It is very, very common, and most of the times it subsides spontaneously or with some little bit home-based treatments itself. But it is more important to recognize what are the conditions where you require a specialist's intervention. So what are the conditions where you should not neglect and seek some sort of medical treatment at the earliest, so that appropriate treatment can be started. Even in these cases, appropriate treatment, if started early, it can prevent your spinal condition from becoming more severe or more worse, which in turn can result in a totally ominous problem like a surgery or something more serious. So if you recognize these problems early, it is better to adopt appropriate preventive measures so that the condition doesn't become worse. We, the team here at Aster RV Hospital, have all the facilities in order to diagnose the low back pain. It's a comprehensive team made up of physiotherapists, spine specialists, and pain physicians, so who collectively put their minds together in diagnosing what is the appropriate or what is the exact reason for this back pain, and provide a comprehensive solution so that these kinds of back pain can be managed in a much better way, and an appropriate relief or a faster relief can be provided to patients who are suffering from back pain. Thank you.